Hi everyone, welcome. Today's session we'll dive into CPR, that is cardiopulmonary resuscitation, a life-saving technique crucial for cardiac emergencies. By learning CPR, you'll be empowered to act when it truly matters. Let us discuss the following topics. First one is introduction about CPR. In this we will discuss definition and importance of CPR and statistics on cardiac arrest survival rates. Second one is understanding cardiac arrest. In this we will discuss causes of cardiac arrest and difference between cardiac arrest and heart attack. Third one is CPR steps overview. In this we will discuss overview of the CPR process and importance of acting quickly. Fourth one is recognizing cardiac arrest. Here we will discuss signs and symptoms and how to check responsiveness and breathing. Fifth one is performing CPR. Sixth, hands only CPR. Seventh one, use of aid, automated external defibrillator. In this we will discuss how to use an aid and importance of early defibrillation. Eighth one is special considerations. In this we will discuss CPR for children and infants and adjustments for different situations. And finally, conclusion. Let us discuss introduction of CPR. First we will discuss definition and importance of CPR. Cardiopulmonary resuscitation, CPR, is a critical life-saving technique used when someone's heart stops or they cease breathing. It involves chest compressions and rescue breaths to maintain blood flow and oxygen to vital organs until professional help arrives. The importance of CPR lies in its ability to significantly enhance survival rates and reduce brain damage after cardiac arrest, highlighting the need for immediate intervention. Statistics on cardiac arrest survival rates. Survival rates from cardiac arrest vary widely. For out-of-hospital cases, the overall survival rate is about 10% to 12%, but bystander CPR can increase this to 20% to 30%. Each minute without CPR and defibrillation reduces survival chances by approximately 10%. In hospital, survival rates are better, ranging from 20% to 25%. Areas with greater access to defibrillators and higher rates of CPR training typically see improved outcomes, underscoring the importance of prompt action in emergencies. Let us discuss about understanding of cardiac arrest. In this first we will discuss what are the causes of cardiac arrest. Cardiac arrest can result from various factors, including heart diseases like coronary artery disease and arrhythmias. Non-cardiac causes include respiratory failure, severe blood loss, and drug overdose. Lifestyle factors such as obesity, smoking, and high blood pressure also increase the risk of experiencing cardiac arrest. Difference between cardiac arrest and heart attack. Cardiac arrest occurs when the heart stops beating, leading to loss of consciousness and breathing, requiring immediate CPR. In contrast, a heart attack results from blocked blood flow to the heart muscle, causing damage, but the heart may still be beating. Both conditions are critical emergencies. Let us discuss CPR steps overview. Overview of the CPR process. Check responsiveness by tapping and shouting. If unresponsive, call for help. Position the person on their back, check for breathing, and begin chest compressions, 100 to 120 per minute, if absent. After 30 compressions, give 2 rescue breaths. Continue until emergency services arrive or signs of life appear. Importance of acting quickly. Immediate action during cardiac arrest is crucial, as survival rates can double or triple with prompt CPR. Every minute without intervention reduces chances of survival by about 10%. Quick response preserves brain function and empowers bystanders to save lives, highlighting the critical nature of timely action in emergencies. Now let us discuss about recognizing cardiac arrest. First one is signs and symptoms and its briefing. First sign is loss of consciousness. The person may suddenly collapse and be unresponsive. Second one is no breathing. They may stop breathing entirely or exhibit only gasping. Third one is absence of pulse. There may be no detectable heartbeat. Fourth one is weak or abnormal breathing. Breathing may be irregular or completely absent. Fifth one is cyanosis. The skin, especially around the lips and fingertips, may turn bluish due to lack of oxygen. And final one is chest pain or discomfort. Prior to arrest they might experience severe chest pain, pressure or discomfort. Let us discuss the important topic in today's session, that is how to perform CPR. CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing, because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you alright?" If there is no response, you need to S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful, as the ambulance service can talk you through the steps. Let us discuss the important step, that is C, that is circulation. Our heart is an amazing organ. It works hard for us every second of every day, delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively, and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes two critical things. 1. Compressions move oxygenated blood to the brain to keep the brain alive. And 2. Compressions keep blood and oxygen moving to the heart muscle itself, so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Important precautions we want to take while compression. First one, what happens when we take our hands off the chest? Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Second one is that what happens when we don't push deep enough? Blood does not reach the brain. The same is true if we do not push fast enough. Let us see what happens when we push too fast. The heart does not have time to refill with blood, therefore not enough blood gets pumped out. Let us see what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood, therefore no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can and don't give up until medical help arrives or an aid is present. Let us discuss what is hands-only CPR. Hands-only CPR is a simplified method of cardiopulmonary resuscitation that focuses solely on chest compressions without rescue breaths. It is recommended for bystanders who are untrained or uncomfortable giving breaths. Place the heel of one hand in the center of the chest, interlock fingers, and push hard and fast, 100 to 120 compressions per minute, to a depth of about 2 inches. Continue until emergency services arrive or the person shows signs of life. Let us discuss the automated external defibrillator, AID. AED is a portable device that can analyze heart rhythms and deliver an electric shock to restore a normal heartbeat during cardiac arrest. Key features of AED. First one is user-friendly. Designed for use by non-medical personnel, AEDs provide voice prompts and visual instructions to guide users through the process. Second one is automatic analysis. The device analyzes the heart's rhythm and determines if a shock is needed. Third one is electrode pads. AEDs come with adhesive pads that are placed on the chest of the person in cardiac arrest to detect the heart's rhythm. Fourth one, shock delivery. If necessary, the aid will deliver an electrical shock to restore a normal heart rhythm. Now let us discuss how AED works. Step 1. Assess the situation. Call for emergency medical help and ensure the area is safe. Step 2. Turn on the aid. Open the device and follow the audio and visual prompts. Step 3. Attach pads. Place the electrode pads on the bare chest as indicated. Step 4. Analyze the heart rhythm. The aid will automatically analyze the heart's rhythm. Step 5. Deliver shock if needed. If a shock is advised, ensure no one is touching the person, then press the button to deliver the shock. Step 6. Continue CPR. If the person does not regain consciousness, continue CPR until emergency services arrive. Now let us see how AED can be used for CPR. Continue CPR and using the AED, following its instructions until help arrives. Let us discuss special considerations. A. CPR for children and infants. For children, 1 year to puberty, gently check responsiveness and breathing. If unresponsive and not breathing, call for help and perform compressions using 1 or 2 hands, pushing about 1.5 inches deep. For infants, under 1 year, check responsiveness by tapping the foot. Use 2 fingers for compressions, pushing down about 1.5 inches. After 30 compressions, give 2 gentle breaths for both age groups, ensuring proper technique to support their smaller bodies effectively. Finally, conclusion. CPR is an essential life-saving technique that significantly improves survival chances during cardiac arrest. Quick recognition of unresponsiveness and initiating CPR, effective chest compressions and rescue breaths are vital. Every second counts, and your prompt action can make a life-saving difference. Regular training ensures you are prepared for emergencies, fostering a community of confident and capable responders. Thank you for your participation today. Together, we can make a meaningful difference in emergency situations.